The new health care bill has people talking. As seen today, changes will affect everything from student loans to tanning salons. But how will the health care bill change the hospital experience or even programs at Weber State? With an inside view as a nurse practitioner and an eye for students as an instructor at Weber School of Nursing, Deborah Judd is here to tell us more. So Deborah, thank you so much for being here.
You're welcome.
It's our pleasure to host you here. We just have a couple questions about this new health care bill. How do you think the health care bill might benefit the system?
Well, I think the overall intent is that there is access to care for all, and the statistics from the Bureau of Labor state that 47 million Americans are uninsured, and probably that many are also underinsured, which means that they don't have access to health care unless they pay for it themselves, and of course many of the uninsured don't have those resources. So I suspect that access to care will be what we achieve, but I think there will also be some issues associated with that over time.
Okay, well obviously that's going to increase the number of people that are going to clinics and hospitals. Will that in any way overload the healthcare system, in your opinion?
I think it's hard to say yes or no to that question, but I suspect initially that there will be some overload and some wait for services. What we know is that about 57% of all medical doctors are specialists, and the intent of this access to care is for primary care services. And so mid-level providers such as myself as a nurse practitioner or even some of the physician assistants will be helping with that. Nurse practitioners for a long time have done that in the underserved population and in rural areas. But I think we'll find here in Ogden and Salt Lake that we do have so many uninsured prior to this that there will be wait for services, particularly things that might be considered elective or non-essential services.
Certainly. Well, along with being a practicing nurse practitioner, you teach here at Weber State. So how do you think the health care bill itself will affect the School of Nursing, if at all?
Well, one of the wonderful things related to this health care bill is the Title VIII edition, which actually Title VIII has been around since the 1950s, but it provides services for students through education loans. It encourages advanced practice roles in nursing, which a nurse practitioner is considered an advanced practice role. And many of our educators are also at an advanced practice level. And so there's a lot of funding available to continue those types of educations to provide not only patient care services, but to train nurses so that we will have them in the future. And as you might be aware, they're anticipating probably about a 3 million RN shortage or registered nurse shortage within the next 10 years.
So do you think this is going to increase enrollment for people who want to look into nursing?
I would hope that's the case. Part of the issue that we have here at Weber, and if you talk to many of our students, they'll tell you this, is that they have to apply to the program generally more than one time. And it's not that they're not qualified for the program, but we don't have all of the resources, including faculty members, to support the number of nurses that we need to change. And so some of this funding from Title VIII and also some money that Bennett has provided will allow us to train more nurses.
Okay, well great. Thank you so much, Deborah, for being here and for giving us some insight on the health care bill as it relates to Weber State.
You're welcome.
We appreciate it.